I had been working in, I guess, the field of traumatic stress for a few years, working with communities impacted by adversity and different kinds of trauma. But what I began to realize was that the scale of mental health issues is just so enormous. And the strategies that we were using were helpful, but we needed to think, I think, in innovative ways to reach more people. And so for me, that was when I think this interest in community mental health really came together.
With Hurricane Sandy, I was actually one of the people leading what we had at the time, Project Hope program, which was a crisis response program to reach as many people, New Yorkers, as possible, because many people were really traumatized. And within a week or two, we brought together community members from the neighborhood, about 30 of them, and just started canvassing the neighborhood. And that was really often the first thing you can do, just kind of make sure, right, people know that someone else is there. And besides doing the one-on-one kind of check-in, we're also going to as many spaces as we could, whether it is in the daycare or the barbershop or wherever you have people coming together, so that we can understand what they needed. Also, how are we gonna now start to move towards feeling better. We bring in mental health to people where they are, whether they're living, whether they are playing, whether they are just doing life.
You know, mental health issues are a global public health epidemic. On average, we're seeing about 1 in 5, 1 out of every 6 individuals struggling with a mental health issue at some point in their life. And if you look currently, you know, at any given moment, and in contexts in which there are major upheavals because of war, climate issues, poverty, displacement, we're going to see those numbers increase, both for adults and for children as well. There are so many factors that I think are driving the mental health crisis around the world, but I would say that, you know, some of the world's leading challenges, the things that we think globally about, are just rippling across society, and people are struggling to find ways to cope and ways to manage these very, very difficult times.
Thinking about globally and bringing that to local, how New York City really, right, is the world all coming together here, and it comes with its challenges. I think about in my role what the healthcare system looks like and how it hasn't been working. As time change, people need change, and when we are more willing to understand and really look at what community need, we see that there's so much that can come from community, the strength and the knowledge and the wisdom that come from that. But also, I think about a lot of the workforce, think about how we don't have enough people doing the work, it's not inclusive enough, people might not feel like it's for them, so they're not tapping into the help. In our role, I think that's what's exciting, that we are partnering to come up with ideas and solutions that work and actually make it available.
I agree, and you know, I also think about the amount of time people often wait until they get support. People don't usually get care until they're in a crisis. We need to change how we think about caring for people. So much earlier on, when people start to notice that maybe things aren't going so well, there's access to support. But I think when we look at these numbers globally, I think part of the issue is that there are very, very long wait times before people are getting the care they need, if they can ever get it at all. So one of the things that I discovered that was so exciting and transformative in the work that I do is being able to partner across sectors, including city government, where there's an office of community mental health, where the job is to think about community-based strategies to build community and thinking about implementing different mental health strategies in ways that is culturally and contextually responsive. And this has been a city where I think we've seen a real coming together. I mean, we've got a long way to go, but I think we've also seen a real coming together of people who want to try to solve some of these issues.
What's really exciting at this time, I think, for us is that openness now, not just, of course, from academia, but also really across even funders, and people are willing to center the voices of community and know that there's not just one way. There's wellness being built out, there's resilience being strengthened. We are putting in what maybe scientifically hasn't shown the evidence, but practices and rituals that different cultures have done, and then really merging it with skills that we know are going to help when people are starting to, when these stressors start to really get to them and they start to really feel not so well. And in my position, that's one of the things that I feel just honored to do, is to be able to have these conversations, acknowledge that, right, people need to rebuild the trust, whether it's with academia or with government, that we are in the spaces to say that we acknowledge the history and also we want to move forward together.
You know, and when you talk about partnerships, I think for me that's one of the biggest drivers of hope for me. The mental health crisis is not going to be solved, as we know, by mental health professionals alone. We really need to bring in lots of voices, lots of perspectives from lots of different fields. And the work that we do, I think, creates that kind of place where we're inviting lots of folks to the table who haven't really been asked before about their perspectives and their inputs on how do we address the mental health issues that we see every day.
We are really expanding the footprint of mental health and who are part of the workforce, who are the part of the people who are really moving things, right? Kind of turning dial. It seems like we say that a lot, but I feel hopeful for that, because we're no longer saying these are the only 2 or 3 ways that we're doing it. There are intervention, there are preventive measure, there are skills learning, and that can include people of different background to come to the table, like you said, so that we can really see changes happening.
And I'm hoping that other cities will look to New York as a model, where you have academic, government, community organization partnerships where you're using evidence as a way to train additional individuals to step in and help deliver interventions to increase that access to care. And I'm hoping years from now, people will see this as a model that was able to scale, not just in New York City, but throughout our country.